Hi, class. For this lecture, we're going to look at schizophrenic disorders. Historically, we used to think that schizophrenia was just one type of disorder, but we now break it down into five different disorders. And then, of course, as we've seen with all these other categories of mental illnesses, then we have sub disorders under that. So when it comes to schizophrenia, as far as the American population goes, 1% of the population, so we'd say about 3 million people suffer from schizophrenia. And we used to just call it schizophrenia. Now it is schizophrenia spectrum disorder. And like I said, you got those subcategories because with all human behavior, thoughts, emotions, everything we do, there's a spectrum to it, right? Life is not black and white, it's not a straight line. Everything is a spectrum. And so when it comes to schizophrenia, it can be one of the most debilitating mental illnesses because of the nature of impairment that it causes. So, it causes impairments in speaking and perception, attention, emotion, social skills, cognition, like pretty much everything that makes you a human being. Schizophrenia is makes you out of whack there, and a lot of it is neurological. We'll talk about that here in just a minute. All right, so we characterize schizophrenia by these abnormalities in what we would say expression or perception of reality. So, a lot of that involves auditory hallucinations, even sometimes there are visual hallucinations. There's a lot of paranoia and delusion, different types of delusions associated with as schizophrenia. And then, like I said, there could be this disorganized thinking, which is like disorganized speech. And that disorganized speech, we call it kind of word salad because it's, people are talking, but they're not really making any sense. It would be something like the goat was on the hill when the twill, eating the twill while he was rolling on the whatever else rhymes with hill, but like really just weird a disorganized speech to where it just doesn't it's a sentence, but it's not a logical coherent type of sentence. And then like I said, we actually have five types of schizophrenia, and these are just the main schizophrenia. We also have that subcategory of those other types of psychotic spectrum disorders too. So we have schizoaffective disorder, and this is when you have schizophrenia combined with the mood disorder. And we really disagree on if we should call this schizophrenia or if it should be a mood disorder. And I believe they're looking to take this out of the DMS-5. And so with schizoaffective, you're going to see those hallucinations, those positive and negative affective symptoms of schizophrenia, along with mood disorder symptoms. So things like mania, things like depression, that overstimulation, right? That feeling of spiraling, and then you add hallucinations and delusions onto that, cause a person to really have a hard time functioning. And then we have catatonic schizophrenia. So catatonic is basically it's a state where you're just like you're kind of brain dead, but not coma brain dead, but you're definitely in a state to where you're just not responding. And so when it comes to catatonic schizophrenia, you don't it's like I said, it's like they're in a coma. It's almost like the person is in a coma, they're dead, but they're still very much alive. So it's like they'll be laying in bed and they'll just lay there and not move for it could be days if someone lets them, or they'll sit in a chair and be in a very weird, kind of twisted up position in their chair, and they'll sit there for a long time like that, and it's just like I said, just a really coma-like state. And then you also see um, there could be catatonic excitement, overexcitement, hyperactivity. There may be, the person. What this means is when the person gets excited, maybe they'll start like cawing like a crow or something. That would be that echo echolalia, I think is how you say that. Or um, echopraxia, which is that kind of movements. So if somebody's like talking, maybe gesturing to something, they're kind of like they're mimicking them. So they're doing those same gestures and stuff too. But it's not like they're mimicking them in this funny. Like sometimes people will funnily joke around and mimic the movements and facial expressions of other people, right? But this is their brains aren't working right, and so they're in an excited state, so they're going to act out in these physical ways. All right, and then historically, we used to not, believe that schizophrenia. We used to think that schizophrenia wasn't something that one developed until adulthood. However, with more research and more testing and more experiences with people and with children, we do know that schizophrenia can come on as early as 10, and in some cases as early as 5 years old. You can begin to see the signs of schizophrenia. And so childhood schizophrenia is also called early onset schizophrenia. And you're seeing all these same positive, negative, affective symptoms, the illusions, delusions, those high emotion, no emotion, all of them, except, once again, it's just in a person that is a lot younger. And when it comes to the African American community, is the schizophrenia does seem to be high among this group, and the thing with that is that the African American community is solely lacking resources for mental health. Pretty much all communities lack resources, but when we start breaking it down and comparing it based on racial groups, we really start to see disparities there. And like I said, schizophrenia seems to be pretty high among that group. And then one of the reasons why we're not seeing a lot of Black people being diagnosed with schizophrenia when they should be and they do need it and need the help in the treatment is because there's really a lot of stigma around the Black community and mental health. And one of the ways that psychology can help there and is trying to help there is to get more Black psychologists. When you have um, people from when you're working with groups of people and you have somebody that is of that same culture, that same identity, it helps create more of that safe, trusting space in order for the healing to take place. And likewise, we say that with the African American community. We see the same thing with Asian community, Native American communities, and then even being in the white community, like I said, there are still a lot of a lot of people not getting help for mental illness. And I'm white, so I'll say it. I suspect white people may be some of the ones who need it the most. You know what I mean? All right, and then fourth, we have disorganized schizophrenia, which we also call hepiphrenia. And this is really where you see extreme syndromes. It's that very incoherent or logical behaviors. This is where I'm, very agitated, very disinhibited, purposeless behavior. Um, We do think that disorganized schizophrenia is the most severe type of schizophrenia because, even just the smallest things that we have to do in the daytime, just, putting your shoes on, and they just they have a really hard time coping and functioning, and so they're not able to verbally communicate either, and so it causes patients to be really frustrated, get really agitated, and this is where people can turn violent. And then last but certainly not least, we have paranoid schizophrenia, and I would say this is the one that we see most portrayed in popular media. It's always the crazy conspiracy person of the aliens in Roswell or Bigfoot or just whatever crazy conspiracy. The Earth is flat. I don't know, guys. Whichever one, no moon landing. All those conspiracies. And so that typical, personification that we see in movies of the person who, has a lot of delusional beliefs in addition, to those auditory hallucinations. And this would be like like I got a crown put in my tooth, and so the CIA is really monitoring me, and the government's out to get me type type of delusions, or it's kind of the other. It could be these grandiose delusions to where maybe you think you're the Queen of England, or you think you're Elvis, JFK, or whatever, whoever else, Justin Bieber, Taylor Swift. I don't know, but it's where people think that they are a famous person, or even more, kind of scary for both the person having the delusions and the person as the recipient, are those paranoid schizophrenia where you see someone start to stalk a celebrity and be like, that think that they're soulmates and they're supposed to be together, and all that craziness, because sometimes those cases end really horribly, right? So all those are paranoid schizophrenia. All right, so when it comes to symptoms, I've already kind of mentioned that we have these positive, we have these negative, and then we also have those cognitive. So, those disruptions in thinking, kind of those disruptions in speaking, and hallucinations, delusions, that's all cognitive problems, something going on in your brain. And we do know, because of medical technology and brain scans, things like PET scans, which are really cool if you ever get a chance to look at them. I wish I would have had a picture of them, for a picture at least. But when you look at those, basically it shows, it lights up different areas of your brain depending on what it is you're doing, what it is you're thinking about. So we have plenty of examples of that neural pathway of what the brain, of what a normal, so-called, normal functioning brain looks like. And then when you compare that to somebody who has schizophrenia, you're going to see a very different light pattern. Now remember, our brain runs on neurotransmitters mostly. It's those neuro connections. So it's kind of electrical impulses. And so, when you do things like PET scans, that's what I'm talking about, light up. You see those electrical impulses, and you see what parts of the brain are active, which parts are not active, which parts are overactive. And like I said, when it comes to schizophrenia, the brain scans are totally different. And so, like I said, so, a lot of this seems to be something that's going on neurological, and schizophrenia seems to be genetic. We call it predispositions. In fact, many of these mental disorders we can say are genetic and are predisposition. So what that means is that we have a DNA for schizophrenia. Okay, so let's say you have it inside of you. That does not necessarily mean that gene will ever be activated. Here's a better example because people seem to be talking about this. I can't remember who is it. Guy plays Thor, Chris Helmsworth. Something about just took some kind of DNA test, and he's going to have get Alzheimer. He has a predisposition to get Alzheimer's, or like there a few years ago, back before COVID, there was the big genetic test for women about if they were going to have that type of breast cancer, to the point that you would have to have a double vasectomy. And so who was it? Angela Jolie was, had the gene, and so she just went ahead and decided to have the double mastectomy, and people thought that was all scandalous. Well, it's a good reason, because just because you have the gene, and even if it's a high percentage, there are environmental factors that have to come into play to activate those genes. It's the same as um, like severe psychosis, like Ted Bundy, Jim Jones, or these people that go out and murder and eat people. Ed Gein's type of criminally insane. That well, for number one, their brains work different too. So the way they're lit up, and then we tend to think that maybe that is a predisposition gene, and once again, so that really starts getting into very ethical issues, like we just mentioned with Angela Jolie and Chris Helmsworth there, is that it can cause unnecessary stress and worry on you, which is interesting because we're going to talk about somatic disorders next, and this kind of relates to that. If you think you're sick enough, can you actually physically cause yourself to get sick? Kind of like the voodoo in a way too. You can think of it that way. Like if you go to a doctor and they say you're going to die on this date, and then that date comes and you die, is it because that was true, or is it because you worried and stressed yourself out so much about that date that when the date came, your brain had already convinced itself that you were dying, and so then you do end up like having a heart attack or something. It's just because of the stress you put yourself under. But like I said, that's more somatic disorders there. So, so even if you have this type of gene, it may not ever be activated. And so, additional ethical issues there are then, do you allow somebody with like a Ted Bundy DNA to reproduce? Do we automatically, when we identify these babies in the womb with this DNA, do we automatically abort them if we don't identify it into childhood? I mean, there are a lot of ethical issues of just saying, oh, you might turn out to be this way one day because you have the genes for it. You can see how that can end up causing dysfunction and mental disorders too. And then, that could be the thing that might actually activate it. It seems like, especially with schizophrenia, it's something very, very traumatic that has happened in someone's life is what causes that gene to be activated. All right, and so when it comes to some of those hallucinations, we say they're visual, they're auditory, they're olfactory, they're gustatory, and tactile. So it's like hallucinations. You can see them, you can feel them, you can touch them. Your body is physically like butterfly in your gut, maybe belly rumbling type experiences, and sometimes they occur without external stimulation. And it's just like you're just kind of sitting in the room and there's nothing that is activating your brain, overstimulating your brain, but you're still having these hallucinations. And that's interesting too, because then that starts putting us into like paranormal the paranormal kind of other supernatural kind of otherworldly type things. Because what about these people that see ghosts, or hear the voice of a god or something? Or are they just all schizophrenic? We'll talk about that a little more in just a minute. And then, sometimes you can see here a person using different voices. So it's like schizophrenia and multiple personality disorder or something like bipolar disorder, where they seem so similar in many ways. And then, as we've already talked about, those delusions, those false beliefs about something, and they can be nihilistic, religious, grandiose, persecutory. And then, when we talk about these positive and negative affective symptoms, it's not saying that these symptoms are better or worse than these symptoms. That positive and negative refers to how they affect the person and whether they're going to elevate or they're going to bring down behaviors and symptoms that we're already seeing. So those negative ones are more diminished or absent type factors, and it could just be a flat, blunted, effective thoughts. We could see, once again, poverty of speech, evaluation. So it's like not really talking that kind of tonic type thing where they're not really talking, not really moving, very socially withdrawn. We don't really understand these negative symptoms, and they're really difficult to treat, but because of medical technology, and we do know that they seem to really originate in like a cluster together there in the frontal lobe of our brain. And then, like we said, those cognitive symptoms are going to be things like memory, attention deficits, difficulties with language, problems with executive functioning. So, like just normal things, order sequential behavior, goal directed planning, monitoring personal behavior, like all of those are gone. And those cognitive impairments at some end of the spectrum, we usually, universally, even in other cultures, you see these cognitive impairments. All right, and like we said, because of advances in technology and research and all those good things, we now know that schizophrenia can manifest in early adolescence and childhood, early onset schizophrenia. Remember, we talked about that a few minutes ago. And now we see that 75% of patients are diagnosed in adolescence or early adulthood. And what we're seeing with these individuals in childhood, you're seeing impairments, dysfunction, and social, cognitive, motor skills. So, poor academic performance, emotional disattachment, motor delays, social isolation. I think I already said that. Sorry. All right. And so we see that schizophrenia, schizoaffective disorder, or usually have this prodromal period. And, this is a period of where we're really starting to see those symptoms manifested, right? And it's really interesting because it may seem like schizophrenia, once somebody has that they never truly get away from it. With all these mental disorders, it may seem like we never truly get away from it, but we just have to remember that a mental disorder, mental illness, means just that. It just means your brain is sick, and there are ways for brains to get better. And that's why maybe one of the most interesting mental disorders, and it's because of the cross cultural ways that we view it. All right, so schizophrenia occurs, so those symptoms are going to occur in phases. And that first phase may be very insidious or acute, so really scary. And we break it down into three distinct phases. So, this is where you just have like that extreme psychosis, delusion, cognitive impairment, hallucination, and that can go on for a little over a year. Then we do see the next phase is the maintenance phase, and so this is when you're trying to cope and deal with those different um, symptoms, and get rid of any residual symptoms. Sorry, I can't think how to say that. And then last, you had the first 5 years after the episode, are known as the early course, and may be associated with additional deterioration that can actually taper off. Long-term outcomes, they really vary between rehabilitation and incapacitation. And like I said, it just depends on the type of resources that can be used to get the person help, and then the way different cultures handle schizophrenia. And there are cultures to where having schizophrenia can live, very normally and function very normally. We tend to think of that as just with primitive cultures, or not primitive, but less developed cultures. In actuality, Switzerland is in Europe and has the highest cases of schizophrenia, and they actually they manage it pretty well over there. And I'll talk about that. See, that's the real fun stuff when you start talking about cultural stuff and the history of schizophrenia. All right, so when we look at gender differences, it seems like men tend to have a younger onset age. Women seem to have oh wait, let's keep with men. Oh, so men that poor, more pre-morbid history, more negative system, and seem to just do worse than women with the disease. So with women, we see more effective, more positive symptoms. Um, and there seems to be fewer hospitalizations and less substance abuse. And then, one of the reasons, because it seems like women respond more rapidly to the medication, which then, improves those symptoms, allows them to function better, and they require not as much medication as men. And interestingly, there is no single symptom of schizophrenia that is diagnostic, and no laboratory test exists to confirm a diagnosis of schizophrenia. And so that is very interesting, even though, we can see these differences in brain activity for some people. We can see this improvement with medication. The symptoms are just so varied in the way that they affect people. And, two people with schizophrenia can act totally different. So, one of the goals of psychology is really about getting that consensus of behavior, because when you have the consensus, then you're able to observe, predict, explain, and control it better. And when it comes to these abnormal psychologies, that prediction and control are good things. It's not control behavior, like, once again, conspiracy, New World Order type control. It's control those symptoms, as in, giving somebody the tools they need to manage those, all these different symptoms that they are experiencing so that they can live a fully functional life, fully actualize. All right, and so when it comes to schizophrenia, there are actually other chronic psychiatric illnesses that people that they are at risk for. I think I said that sentence wrong. People with schizophrenia have a higher risk of developing other chronic illnesses. All right, so things like obesity, diabetes, glucose dysregulation, cardiovascular disease, actually 12 times higher with people with schizophrenia than the normal public. And then, of course, there are side effects associated with medication, things like weight gain. And then because schizophrenia seems to affect people more in so-called minority communities, things like poor diet, lack of access to that medical resources, medical care, maybe even a sedentary lifestyle, like all of that is going to combine that with the schizophrenia, and you're going to see increased morbidity and mortality rates. Hypertension is also something else that is common. And then, once again, poor diets, those, high in fat, low in fiber, often, poverty, unstable living conditions, and then, eating too much fast food is all bad. And I would say, in general, whether you have schizophrenia or not, just too much fast food is bad for us. And then it just seems like overall people with schizophrenia are just less active and just less physically fit than the general population. And, because lack of physical activity is what causes obesity and cardiovascular disease. It's very alarming. And then for people with schizophrenia, that's going to bring on more of those negative effective symptoms, and then, once again, just lack of resources. All right. So when it comes to the causes and prevalence of schizophrenia, we've already kind of talked a little bit about this. We know genetic, we know neurological, and some of those neurological, actually, other than being genetic, like we talked about, some of the ways that it can come up neurologically would be in the womb. So, some type of prenatal virus, some type of birth injury, some type of psychological stressor. And there are cases that show that children that are born in high poverty areas, and I think it was done on Black community. So children born to Black women in the winter in high poverty areas tend to see we tend to see more of those babies being diagnosed with things like schizophrenia or depression. It has something to do with, not, of course, the color of the person's skin. That doesn't have anything to do with it. It has to do with environmental factors of, they think it has to do with weather, and how just, in the winter, people tend to not be as healthy anyway because their bodies are adjusting to cold weather. And then if you combine that with, like, say, smoking, I think a lot of those women smoke too. So smoking, and then, diet, combining all that together, it does cause issues with the developing baby there, so that was interesting. And then, like all things we know about development and personality and genetics and psychology, has to do a lot with twin studies. And we say adoption studies because we're talking about those cases where twins have been separated, but we still see, these genetic bases, or we still see, behaviors that are similar. And then, when we're looking once again at some of those gender differences, a lot of it is environmental. Once again, that gene has to be activated. Something has to happen to trigger those symptoms to come on. And so, hostile, critical family environments, just bad communication, um, lack of emotional intelligence and emotional expression, these people that just blow up over everything or cry over everything, like those types of stressful family home environments or even work environments can cause schizophrenia to be activated. All right, and so when it comes to the goal of treatment, like I said, it's not like you ever truly get away from having a mental disorder, but that, brain gets sick, the brain can get better, in the context of mental illness, the way the brain gets better is by those different research techniques and treatments, medication, psychoeducation, therapy, all of those things combined are at least going to help people, manage the cause of their sickness, manage the sickness of their brain, and then allow them to function in society. And, of course, that's one of the number one goals of psychology, is to make sure that, to help people to heal. And the way we do that is by helping give people the tools, knowledge, and resources necessary for them to go out and live meaningful lives where they are, enacting their self-efficacy and working towards becoming their best and higher selves and all that good stuff, right? And so historically, this is where, once again, if schizophrenia is really the main mental disorder that started the field of psychology. I'm just going to go ahead and say it. It has existence since ancient cultures. And so one of the ways that one of the milestones in the history of psychology was the invention of medication. Lithium chlorazepam, actually chlorazepam with the thorazine, was created first, and it was created to help people with schizophrenia. So, I'll go more into that here in a minute. So those antipsychotic drugs, we know that they can really help in treatments. And then, like we said, rarely is somebody just going to completely recover, completely just be cured, because life is a learning and growing journey. And are all of us ever completely recovered or truly healed from anything in our past? No, we take the things that happen in our life and we learn how to move past them. So just reiterating there that, antipsychotic drugs are, the main way that we have treated schizophrenia. And of course, now psychology is a little more holistic and likes to combine different types of therapies rather than just throwing at all of it. All right, so like I said, when it comes to the the cross-cultural experiences of schizophrenia and the history of schizophrenia, it seems like, no matter what culture one is from, schizophrenia is one of those diseases that we just always see. Now that's not true for all cultures. There are some cultures that independent of Western influence don't have, disorders. A really good one is eating disorders. People and there was a good experiment that was done on somewhere in East Asian. I can't remember. It was either the Philippines. No, it wouldn't be the Philippines. I forget, but they did it down in the Southeast Asian island cultures there. And what they did was they showed, this was probably back in the 90s or the early 2000s, and they showed all these adolescent girls these these old TV shows from the 70s. So think like Sonny and Cher and Charlie's Angels and all these ones where the women were very thin, very beautiful, because in the 70s white women had, the idea was that they were anorexic. That's kind of where anorexia started, and there was a lot of cocaine use going on at that time too, and other things like quaaludes and all sorts of different types of stimulants, especially for these actresses who were supposed to look a certain way. Models, that was really big in the 70s and 80s with models and how, anorexic models had to be. And so after these little girls saw and watched these TV shows, they started developing these poor self images, start thinking themselves ugly and start thinking themselves fat. And so then some of them developed eating disorders. Some of them started, developing depression because they didn't see themselves as these women, and that is, I think, universal. I think when it comes to little girls, we have to be careful what we are showing the younger generations and the ideas and images of how they should be and who they should be. We definitely treat them to be more respectful and considerate and compassionate than worrying about, what people look like, right? So anyway, so that's just an example of how some cultures, don't have mental disorders and until you get this outside environmental influence. Schizophrenia seems to go far, far into the past of human evolution. We have evidence of skulls from, ancient times, guys, thousands upon thousands of years ago, that show these ancient surgeries that they would do. And so it was called trepanation. And so somebody who would be what we would call schizophrenic would see things, hear things, be delusional. They would basically drill a hole into the skull, and it was a spiritual reason. So they thought that, that person was being possessed by not necessarily demons, because you have to remember these cultures weren't Christian, so it wasn't all, God, angels, and demons, but there was ideas of good spirits, bad spirits, ambivalent spirits, and so, they would think that that person was possessed by, more of those darker type of beings or entities, right? And so by drilling that hole in their head, they were allowing those evil entities to escape. Now, here's the most interesting part about this ancient surgery is that people survived. The people survived the surgery, and we know that because of, from archaeological and forensic type osteological evidence, because you can see where that hole, you see where it healed up. You can actually see that on skulls, on skulls. You'll see, where it healed up. And then, there's usually another cause of death that is going to be apparent on those remains. So, sometimes people live 10, 20 years past having that surgery done. And I always thought that was really cool. And so fast forward until about the we'll go with the 1400s in Europe, because by this time we have more of a a Roman Catholic Church and Christian influence on European society. So schizophrenia is, we still see the spiritual possession, but this at this point is where we start getting the kind of exorcist possession type ideas of these are demons from hell, spawns of Satan that are controlling this person. And that's interesting because in many parts of the world, and even in our modern societies, there's still this idea that demons can possess people, and exorcisms are performed by the Catholic Church. Of course, though, it's like a huge process. They're just not running around willy nilly handing out exorcisms for, every 12-year-old normal girl that is just doing normal, 12-year-old girl acting out things. Any of you guys ever were a 12-year-old girl or have a child, you kind of know what I'm talking about. And so yeah, so it's interesting, and even in that Catholic Church will do that in modern societies, and we even see in more less developed places, like there are parts of Africa where some cultures were influenced by Christianity, and so they do possessions. And then just based on some tribes in Africa already had these ideas of spirit possession, so they have their witch doctors, and they will deal with deal with these more severe cases of schizophrenia in ways culturally appropriate. Same thing with like in the Caribbean islands. You think of, once again, kind of voodoo type cultures. There is schizophrenia associations there, and some of the things they do to help cure that person, get those demons out of them. And then, so that's pretty much how schizophrenia was dealt with until we get to about the 1930s, 1940s. I can't really remember when, but it was sometime within that decade. Oh, and I can't remember his name either. But anyway, LSD, lysergic acid, that people trip on. Yes, that LSD was invented by this little German scientist. He didn't really understand what he had made when he put these chemicals together in his lab. So, super cute story. He somehow got it on his fingers, so it ended, the LSD ends up absorbing in his skin. And as he's riding his bike home, he notes in his journal how he, basically started tripping. Everything got brighter. The bird songs were more clear and more beautiful. And he talks about how, the trees were radiating energy, everything felt alive, which is like all signs of tripping on acid. And so, yeah, that's how acid was invented. And so, fast forward to the 1950s and the 1960s. This is when we really are having these major breakthroughs, medical on the medical side of it, and how we treat mental disorders, and once again schizophrenia. So this relates to the history of mental institutions too. So a lot of soldiers coming back from World War II had what we called shell shock, which is, of course, PTSD. A lot of them, we suspect more of it was more the schizophrenia gene got activated. So there were lots of men suffering, and they were locked up in mental institutions. Of course, women too. We'll get to that part about women in mental institutions, but being locked up in mental institutions, didn't really understand these mental illnesses or how to treat these mental disorders. And even up until the 1980s, there were a lot of heinous things and a lot of torture and mistreatment of people in mental institutions. Back in the 30s, 40s, 50s, 60s, they would do things like ice baths. Um, Patients that refused to eat, they would knock their teeth out so they'd be able to feed them. They would leave people chained to bed and naked in rooms covered in their own feces, as a way to like teach you, that'll teach you from acting out, because they didn't understand. No, these people's brains are sick. They don't really, they're having a lot of trouble functioning here and communicating what it is that's going on with them. And then when it comes to women, by once again the 50s to the 70s, a woman, even actually we'll start with the 19th century, from like the 19th century up until about the 70s, 80s, A husband could put his wife in a mental institution for no reason other than she showed signs of being an intellectual woman, or she's mouthy and talks back to me, or she won't do what I say. Then, those are, or, women go through menstrual cycles. And so sometimes those symptoms associated with menses, that would be a cause for women to get locked up. That was really, a big thing during the Victorian period. And then by the 50s, they came up with lobotomies, where basically they take an ice pick and I think it's through the left eye. They'll take the ice pick and in this perfect position in your left eye, they'll knock it through, and it does not kill you, but it kills the connection in your brain that makes you a human being. So you walk around in this pretty much like robotic, animatronic state. So you see how that was appealing to men to be like, my wife's mouthy, she won't listen to anything I say. Well, give her a lobotomy, and you've got yourself a compliant little kitten for the rest of your life. You've got a child, and it was Kennedy's. One of the girls in the Kennedy family actually suffered from, John F. Kennedy, the one of our presidents in the 60s that was assassinated. One of his sisters, I believe, but it was one of the girls in that family actually had mental disorders. I think maybe now looking back, maybe she just had like ADD or something, but she was given a lobotomy, and they talk about, she was pretty much like a child for the rest of her life. Like, lobotomies were really bad things in that day. And like I said, just, anything you did to make a man mad as a woman could get you end up in a mental hospital and be given a lobotomy. And so let's go back to this idea of schizophrenia, though. So, because seem like the majority of these mental institutions, schizophrenia, were the most common disorders being dealt with. Medication was revolutionary when it came out. Like I just said, Thorazine, or also chlorazepam is what it's called, was the first medication invented. It was used to treat schizophrenia. Lithium was the second one. And why these medications were so revolutionary is because it allowed these people to get out of the mental institutions and actually go live and function within society, and pretty much have normal lives. Now, let's get back to LSD. So, by the 60s, maybe even into the 70s. So here in America, we have the whole counterculture, hippie revolution going on. A lot of anti-war sentiment because of Vietnam, and then we also see this rise of LSD. Timothy Leary McLeary, and he wanted to start this whole LSD church, and so they would go around the country and proselytizing to people and dosing them with LSD, and so some of that was problematic because they dosed a lot of unsuspecting like college students and teenagers, and so that caused sometimes these kids would just total psychotic breakdowns because of it, because I didn't really know what was going on. But yeah, Timothy Leary, it's Timothy Leary, not Nick Leary, but Timothy Leary. And like I said, he wanted to start this whole church based on LSD and thought that it was going to be the drug that was going to unlock humanity and help us all move to those next steps of evolution. So really interesting stuff going on there. And then we turn to Europe and how it is treating schizophrenia. So LSD is one of the first ways that Europe treated schizophrenia. There is one of my favorite psychiatrists. His name is Stanislav Grof, Grof. So Stan Grof. And as I already mentioned, schizophrenia is really high in Northern European European countries, Switzerland being one country where it's been studied extensively and treated extensively. And so Dr. Groff has been working with schizophrenic people since the 1960s. And so he talks about how when LSD was created and it was sent to them, and they were encouraged to give it to their schizophrenic patients as a way to, because something about giving them LSD, it kind of like, because their brains weren't working right, it kind of set their brains right so that they would have these moments of lucidity. And then for the doctors with the normal functioning brain, they were encouraged to take to trip as well so that they could understand the psychosis that their patients were going through by having those, LSD trip hallucinatory experiences as the doctor, it would help you get into the minds of the psychiatric patient and how to give them that healing better. Okay, now interestingly, LSD was also used in the beginning there to treat abnormal menstrual bleeding. And I don't even think they called it abnormal menstrual bleeding. It was just to treat menstrual bleeding in women too. So that's very interesting. Can you imagine being given LSD every menstrual cycle? That might be kind of fun, ladies. I don't know. But so yeah, so that's interesting. And now Dr. Groff has created this whole new subfield of psychology called archetypal psychology. And it's basically a combination of psychology and astrology. So it's like looking at people's astrological signs, looking at the placement of the planets in relation to behavior. Okay. Now, we already know that during a full moon cycle, we see people act crazier. Hospitals are packed on full moons. Police get more calls. 911 gets more calls during full moon. The full moon seems to exacerbate the crazy in a lot of people. You can say maybe whatever gene is predispositioned there, that the full moon definitely activates that. And so it seems and common sense that by looking at the influence of these other planets, that might be key to helping people manage their psychotic episodes, their mental disorders. And so, what Dr. Groff is seeing is that, and I would say this is very true, when these episodes come up, these schizophrenic episodes, things like, with bipolar or depression, those hypomania, mania, when these cycles come on, that they are indeed cycles. And so if you can really narrow down straight traits specific to that individual, you can really get an idea of the cycle of these episodes, then it's a way for these people to manage them better. And maybe Dr. Groff has done too much LSD in his life, and he does, the whole astrology aspect of it seems a little woo woo, but it makes sense to me, once again, because I think about that moon association, and it makes sense too, because with mental illness, if anybody has ever had to deal with somebody with that, or if you work on that on your as yourself, you suffer from something, you do know you have these bouts and phrases and phases. And so by tracking those different phases, it's a way to help the person prepare. So you can be, okay, Jen, so the end of the month is coming up, or it's going to be da 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 going on this time, and that's usually when you seem to have your bouts of depression come on. So what can we do to prepare yourself between now and then? Or hey, John, it seems like in the second week of the month you seem to have those most profound hallucinations. Maybe what can we do to maybe start preparing and helping you to deal with that. And then, interestingly, another way that they will help people with those kind of delusions and hallucination, those auditory, visual, through art. It's like, okay, well, if you're hearing voices, write down what they're saying. A lot of schizophrenic people, they will draw, they're very expressive and will draw and paint different things. And then, like I said, just preparing them, be like, okay, well, if the voices always come and they always want to have this type of conversation, what what is that plan that we can come up with to change that dialogue? So you don't have to be scared that those voices are coming to talk to you. You take control of what those voices are. Kind of like with multiple personality syndrome, which we now call dissociative identity disorder. You help the individual and that main personality, you kind of like introduce the one main personality to all the other personalities, so that individual feels some kind of control. That is what this all comes down to, is just having some kind of control. Okay, sorry there was a little abrupt transition, you guys. I had a little technical difficulty. So I was talking about that idea of, being able to identify and identify those cycles of when these episodes come up for the individual, and then helping them feel like they have some kind of control over what's going on with them. Now, when we look at more of what we call the less developed cultures, more of those cultures where they have things like medicine men or witch doctors or shaman, or they have some kind of medium, or where they believe that you can communicate with the other world, you can communicate with the beings in the other world, you can communicate with dead ancestors. They have taken people from modern society with schizophrenia and taking them somewhere like Pompeii, New Guinea, where schizophrenia, these people who see and hear things, they do listen to what they do, take it as messages from, like I just said, the other world, from the ancestors, from the gods, whatever that message is from or who they say it's from. There are cultures that take that seriously, and you may laugh and scoff at that idea, but what we have seen is that these people weren't able to function in modern society. Yet, when they went and lived in these other cultures, these people are thriving. They're doing better than they ever would have here. Even like, those really disorganized schizophrenic cases, or like those catatonic schizophrenic cases. I find that interesting, and it once again makes me think about the whole idea of what is normal and abnormal to begin with, because when we look at the beginning of psychology and the beginning of what we know as abnormal behaviors, one, it was like something wrong with you. In reality, psychology was saying, no, people like Freud and Saza would say, no, people suffer mental illnesses because there's something wrong with society. It's these outside influences that are creating mental and emotional and spiritual havoc on people. So we need to step back and look at how we're living and re-examine that. And it does seem like, outside influence do seem to really negatively affect us more so than inner working type genetic type stuff, because stress can cause anybody to snap. So yeah, so I find it interesting that schizophrenia people with schizophrenia can find a place and a purpose in society. It just goes with how we want to go about dealing with, once again, just dealing with those behaviors, and how, as a culture, we go about viewing those types of behaviors so that we do find that place for everybody to successfully work and get along. All right, guys, so that wraps up this part of our lecture on schizophrenia. In our next lecture, we'll talk about somatic and dissociative